Welcome back to the Dr. Paul Health and Wellness System podcast, where we take the pregnancy questions that keep moms wondering, worrying, and sometimes searching the internet at midnight and give you clear, practical answers you can actually understand. Today, we're answering some of those questions that may sound simple, but almost every pregnant woman has thought about at some point. Can laughing too hard hurt your baby? Can crying affect your pregnancy? Is it safe to sleep on your stomach? Can you drink cold water? Can stress really cause a miscarriage? And when does itching during pregnancy become something you should take seriously? Some of the answers may surprise you, and a few of these questions involve warning signs every pregnant woman should know. So whether you're newly pregnant, already in your third trimester, or supporting someone through pregnancy, stay with me, because today we're separating pregnancy myths from what medicine actually tells us. I'm Dr. Paul, and let's get straight into our first question. No, laughing hard will not hurt your baby. Your baby is safely protected inside the uterus by the uterine muscles and amniotic fluid. Sometimes when you laugh, cough, or sneeze, especially later in pregnancy, you may feel a sudden pulling or sharp pain around the lower abdomen. That is often from the ligaments supporting the growing uterus being stretched. So please, laugh as much as you want. Pregnancy already comes with enough worries. Your laughter is not one of them. If laughing or movement causes severe or persistent abdominal pain, bleeding, leaking fluid, or regular contractions, contact your maternity team. Crying occasionally will not harm your baby. Pregnancy hormones can make emotions much stronger. You may find yourself crying over things that normally wouldn't bother you, and that can be completely normal. What concerns me more is when sadness, anxiety, or stress becomes constant and begins affecting your sleep, appetite, relationships, or ability to function. Your emotional health is part of your pregnancy health too. If you're feeling persistently sad, anxious, overwhelmed, or unable to cope, please talk to your doctor or midwife. Don't feel you have to carry it alone. In early pregnancy, sleeping on your stomach is generally safe. Your baby isn't lying directly underneath your skin. The uterus and surrounding tissues provide protection. And as your pregnancy progresses, your growing belly will usually make stomach sleeping uncomfortable naturally. The position I want you to pay more attention to is later in pregnancy. From about 28 weeks onward, try to go to sleep on your side. Either side is fine. And if you wake up on your back, don't panic. Simply roll back onto your side. After 28 weeks, going to sleep on your side is recommended because lying flat on the back can affect blood flow and has been associated with a higher risk of stillbirth. Yes, you can drink cold water during pregnancy. Cold water does not make your baby sick, it doesn't make your baby too cold, and it doesn't harm the pregnancy. Your digestive system warms what you drink. The important thing is not whether your water is cold or room temperature. The important thing is that you are drinking enough fluids. So if cold water helps you stay hydrated, enjoy it. Pay attention to hydration, especially in hot weather, during vomiting, exercise, or fasting. Very dark urine, dizziness, extreme thirst, or reduced urination can suggest dehydration. This is one I hear all the time. Doctor, I'm vomiting a lot, so does that mean it's a girl? Or I'm carrying low, so is it a boy? The answer is, your symptoms cannot reliably tell you whether you're having a boy or a girl. Pregnancy symptoms are mainly influenced by hormones, your body, your genetics, and the individual pregnancy. Two women carrying baby girls can have completely different pregnancies. So enjoy the guessing game with family, but medically, don't use morning sickness, cravings, belly shape, skin changes, or fetal heart rate to determine your baby's sex. Food cravings are very common in pregnancy, and hormonal changes can affect your taste and smell. But there's an important difference between craving unusual foods and craving things that are not food. If you're craving things like clay, soil, chalk, paper, laundry starch, or even constantly craving ice, please tell your doctor. We call this pica, and sometimes it can be associated with iron deficiency or other nutritional deficiencies. Don't eat non-food substances because some can cause poisoning, infection, constipation, or intestinal blockage. Your doctor may want to check your blood, particularly your iron levels. This one depends on your health, your stage of pregnancy, and the type and length of the fast. Pregnancy increases your body's need for fluids, calories, iron, protein, vitamins, and other nutrients. So long periods without food, and especially without water, can become difficult for some pregnant women. If you're fasting for religious reasons, please speak with your obstetrician or midwife first, especially if you have diabetes, anemia, high blood pressure, severe vomiting, a multiple pregnancy, poor fetal growth, or another pregnancy complication. And please don't try to prove that you can endure the fast. If you're fasting and develop dizziness, weakness, fainting, very dark urine, severe headache, contractions, or reduced baby movements, break the fast, hydrate, and seek medical advice. Yes, most women with an uncomplicated pregnancy can travel by car, but long journeys require a little more planning. Wear your seatbelt correctly. The lap belt should sit low under your belly, across your pelvis, not across your bump, and the shoulder belt should come between your breasts. Long journeys of more than about 4 hours can increase the risk of blood clots, so movement and hydration are important. And if you have pregnancy complications or you're close to delivery, discuss a long trip with your maternity team first. This is important because many women blame themselves after losing a pregnancy. Normal everyday stress, having a difficult day, arguing with somebody, worrying about work, or crying is not considered a typical cause of miscarriage. Most early miscarriages happen because the pregnancy was not developing normally, often due to chromosomal problems that were completely outside the mother's control. That doesn't mean we should ignore severe or long-lasting stress. Chronic stress can affect your sleep, appetite, blood pressure, and overall well-being, so it deserves attention. Take care of your mental health, rest when you can, accept support, and speak with your healthcare provider if stress or anxiety is becoming difficult to manage. And if you're pregnant and develop bleeding, significant cramping, severe abdominal pain, dizziness, or leaking fluid, seek medical assessment rather than assuming it's stress. Some itching during pregnancy is common. Your skin is stretching, your hormones are changing, and your skin may become drier or more sensitive. But severe itching all over your body is something I don't want you to ignore, especially if there is no obvious rash, the itching is worse at night, or your palms and the soles of your feet are extremely itchy. Because sometimes this can be a sign of a pregnancy-related liver condition called intrahepatic cholestasis of pregnancy, or ICP. ICP can affect the pregnancy, so it needs proper testing and monitoring. If you're experiencing intense generalized itching, particularly on your hands or feet or worse at night, contact your maternity team promptly. They may need to check your liver function and bile acid levels. Don't simply keep applying cream and assume it's normal pregnancy itching. And that brings us to the end of today's episode. If there's one thing I want you to remember, it's this. Not every strange feeling in pregnancy means something is wrong, but knowing which symptoms to ignore and which ones to take seriously can make a big difference. Laughing, crying, drinking cold water, traveling, cravings, stress, sleeping positions. Pregnancy comes with so many questions, and you should never feel embarrassed for asking them. But also remember the important warning signs we discussed today, especially severe itching, unusual pain, bleeding, reduced baby movements, dehydration, or symptoms that simply don't feel right. When in doubt, speak with your doctor or maternity team. If this episode answered even one question you've been worried about, share it with another pregnant mom, save it, and leave your own pregnancy question in the comments. Your question could become part of our next episode. Don't forget to like, share, follow, subscribe, and join us every Monday and Friday for more simple, practical pregnancy and women's health conversations. I'm Dr. Paul, and until next time, take care of yourself, listen to your body, and take good care of that little life growing inside you.